President Obama is about to emerge for the Rose Garden at the White House to talk about health care reform. He's also headed for a meeting with Democratic members of the House Energy and Commerce Committee. That committee postponed today's health care markup session. A markup is where the committees essentially write the bill that they want the rest of the House to vote on. That committee's been struggling to reach an agreement with moderate Democrats. So why are these so-called blue dog Democrats holding out on the president's massive overhaul plan for the health system in this country? Joining us is one of them, Congressman Dan Boren of Oklahoma. He is a member of the Blue Dog Coalition, although I should point out he is not on that Energy and Commerce Committee that was supposed to hold the markup today. The president does not seem to be doing real well, even among some Democrats, when it comes to health care. What is the biggest hang-up that you see?
Well, I think most of us do want reform. I've got a district in eastern Oklahoma where we have a lot of people who are uninsured. I think the main sticking point really right now is in the House bill with the surtax. Also, we're concerned about other ideas to tax benefits. There's some positive things in the plan. We want to make sure that we cover people with pre-existing conditions, but we need a bill that's in the center. We want bipartisan consensus. I think that's what most people want. We can't just have one or two Republicans. We've got to have a broad swath of the Congress. It looks like it's starting to happen in the Senate and the Senate Finance Committee, but the House has been a little bit bogged down with kind of a bill that's on the left flank, and hopefully we can bring it to the center. And, I'm hopeful that the president will have this meeting and maybe we can get some compromise here.
You have been quoted as saying that the president is too liberal and very unpopular in your district back in Oklahoma. I'm sure those words have reached the White House. What kind of heat are you taking?
Well, I represent my district. My district's very conservative. It's a district that John McCain carried with 66% of the vote. But at the same time, I'm a Democrat. I want to make sure that this administration and this country is successful. And the way for it to be successful is to be bipartisan. Most people are not far left, they're not far right, they're somewhere in the middle. And they want to get things done. There's an old saying in my district, get her done, and we've got to get it done. And to do that, and for Democrats, frankly, to be successful, is we've got to be seen as centrist, as moderates, as pragmatic. We can't just sell on the East and West Coast. We've got to sell in places like Oklahoma. And we've had some stumbles early on with this health care debate, but I'm hopeful. I want to support something. My fellow Blue Dogs want to support something. Right now, the bill that's been in the Energy and Commerce Committee is not there yet, and so we've got to work on it. And I'll work with whoever it is, whether it's Democrats or Republicans, because both sides have good ideas, and let's get together and get this job done.
One of the pivotal points for Blue Dogs, according to your own website, is that the public would not be asked to pay. I mean, that nothing would come out of the federal treasury to pay for the health care reform. The Congressional Budget Office says that this thing would add at least $240 billion to the deficit. So how do you reconcile those two?
I think that was the real game changer when the CBO came out with that estimate of the real cost of this bill. And I think it's why you've seen some people backtrack on full support of the legislation. That's why I think you're going to see some compromise come out. We've got to slow things down. We may miss a target deadline of going into the August recess. We may take it into the fall, which I know some people may say, well, golly, politically that's not expedient. But we've got to do what's right. We've got to be thorough. And that's what my constituents want. I was home in Muskogee, Oklahoma on Saturday in a barbecue, and people are coming up to me. They're saying, why did you get a bill hours before, hundreds of pages, and then have to vote on it very quickly? And that's what happened in the climate debate. We don't want to do that with this health care reform, because it's so important. We want to cover people. We want to lower costs. We want to have more access to places like rural Oklahoma.
Congressman Dan Boren of Oklahoma, one of the Congressional Blue Dogs. Thank you.